Now, CTV News Infectious Disease Specialist Dr. Abdu Sharkawy. Dr. Sharkawy, always appreciate your time here on CTV News Channel.
Good afternoon, Angie.
Let's talk about vaccines. We are talking about, of course, the delay. Now we're hearing from Pfizer, but then that also raising the question, those that have received their first dose, will they get the second dose within the 3-week time? And then there's also that recommendation saying that, it can be pushed up to 42 days. What are your thoughts? I know you yourself did receive your second dose earlier this week.
Yeah, I was fortunate to have it exactly on label and exactly as it was tested in the trials. But I think we need to be mindful of the fact that the trials were done in as expedited a fashion as possible. And that's sort of a minimum window between a first and second dose to try and boost immunity to prime it. It doesn't mean that you can't boost immunity and get a successful response with antibody production if you delay that second dose. And in fact, if you look at modeling that was done by the Ontario Science Table, which I think was very thoughtful in terms of the parameters it laid out, it actually showed that if you extended the dosing interval to 35 days, even up to 50 days, there was a relative impact and a benefit that was more towards delaying that dose as opposed to not doing so. Really what the key is here is making sure that we don't reserve the second dose.
Right.
It's much more important to get as many first doses in as many arms as possible than reserving that second dose and holding on to that idea that you're going to do it exactly at 21 or 28 days. That's not a winning strategy. You need to have as many people even partially immune, and that'll reduce transmission as opposed to having fewer completely immune. And I think that's the rationale behind the strategy and why it will work.
And let's also remind Canadians as well, the vaccine is certainly very critical in all of this. But during that time, in between that time, between the two doses, or even after you've had the full vaccination, we still need to stay vigilant in what we are, because it doesn't mean COVID-19 goes away. People can still get sick.
Oh, no doubt about it. We have to recognize not everybody knows exactly when their immunity has been constituted. We don't have mass antibody testing around to prove that right now. And there is a possibility, albeit not a very large one, that you can become reinfected. So we have to be absolutely careful. We can't take anything for granted. Never mind the fact it's not really good modeling to stop distancing or to stop wearing a mask or doing anything else. It sends the wrong message to everyone in your community. So I'm not changing my practice one iota until herd immunity happens in Canada.
Yeah, no, absolutely. And as we do that, we again continue to track the cases as well. Ontario, just over 3,000 new cases. Quebec bumping up well over 2,200 cases. As we're following the trajectory in all of this, and then couple that with how that affects what happens in hospitals and ICU units, what is the message here again? And the concern again that just because we might see a dip in numbers in one day doesn't mean that we're now bending the curve.
Yeah, first of all, 3,000 cases a day in Ontario, 2,000 plus in Quebec is certainly nothing to write home about. Yeah. We are cautiously and guardedly optimistic that the rate of rise is improving. So we've got a big fire, but it's not spreading as rapidly as it did maybe a week and a half ago. But the impact that this has on our healthcare system doesn't dissipate quickly. Once the hospitals start to fill up, once the ICUs become a bit overwhelmed, the patients don't just turn over very quickly. It takes time for sick patients to be managed and for beds to be freed up and for the resources to be freed up. So there's a real lag in time in terms of what happens with our healthcare system's capacity. And we've got a lot more work to do to make sure that those resources continue to be freed up so we can take care of everyone, regardless of whether it's COVID related or not.
And part of that action also needs to be to help those who, as we know in Ontario, there's a stay-at-home order, those that are basically saying, I can't afford to stay home. But if they had that paid sick leave, then that certainly would be a very important option for them. How critical is that? Is that needed right across the board?
I can't overemphasize that. In my opinion, that is low-hanging fruit. We keep hearing from our policymakers that everything is on the table. Well, guess what? There's a lot of people who are struggling to put food on that table and to pay their rent. And it's a very difficult choice to be in, to decide whether you're going to risk potentially losing your job or getting a COVID test, going to work with a sore throat. We shouldn't have to be in that situation. We should be able to give people the confidence and security they need so that they can get tested, they can isolate safely, and make sure that their security, their income, their ability to support themselves and their families is not jeopardized.
Yeah, absolutely.
That needs to happen.
Yeah, no, absolutely. And the hope is that also continues well after this pandemic, because there's a lot of support that's needed for so many Canadians right across this country. CTV News Infectious Disease Specialist Dr. Abdu Sharkawy. Always great to have you, Dr. Sharkawy. I know that you're working today. We won't keep you much longer, but